Hey guys, welcome to another enlightening episode of Let's Be Blunt with Montel. I'm your host, Montel Williams, and your guide through this evolving world of cannabis. And today, we're peeling back the layers on what it takes to start a cannabis business amidst the significant regulatory changes. The DEA just recently poised this, stated that they are thinking about reclassifying cannabis, marijuana, from Schedule 1 to Schedule 3, signaling a pivotal shift. To dissect this and what this is going to mean for budding entrepreneurs, we have with us Alexis Rosenberg, a pioneer legal authority and co-founder of Rosenberg Law. Alexis, thanks so much for being a part of the show today.
Thank you so much for having me.
Absolutely, for sure. Look, let's kick things off by telling us a little bit about your background, your roots, your educational path, and how you ventured into representing the cannabis industry.
Sure. I've been practicing law for over 20 years, almost 25 years, which is just crazy to think about. I primarily started out doing a lot of business litigation and healthcare litigation before we were able to dive into this whole cannabis industry. And it just kind of collided nicely together because, especially in Florida, since we are still medical marijuana, combining the two, backgrounds, education, and experience that I have with the business end, as well as with the healthcare, because as I think we can all agree, cannabis is, a form of healthcare that should be used in the treatment for many.
Yeah, without a doubt. Now, the DEA's latest move in this game in the last couple of days has been thinking about changing the status, changing from Schedule 1 to Schedule 3 drug. Let's talk a little bit about how this may, or how you perceive this may impact individuals stepping into the cannabis business, and how it's going to impact the business, the industry all as a whole.
Yes, I mean, it's very surprising. It's good movement. As we all know, that was breaking news, I believe yesterday, the Biden administration said that they're really thinking about, reducing the classification, like you said, of cannabis, marijuana from Schedule 3. And all of us should realize, Schedule 1, I'm sorry. And all of us should realize that Schedule 1, we've got heroin and LSD on that schedule, down to or up to Schedule 3. And just so everybody understands, like Tylenol with codeine is a Schedule 3. And this has major impacts, and it's historic, really, because since 1971, we haven't had a change related to cannabis once it was put on under the Controlled Substance Act. There are some Democrats that are actually pushing to have it taken entirely off of the schedule and guidance under the Controlled Substance Act. But this is going to have major, major, major implications if they do this. For one, it's going to assist with the banking, because there's also another law that they're tossing around that would make it legal for these cannabis businesses to bank under traditional banking.
Because COAE was established because it was an illegal drug, therefore they could not have some of the tax implications that cannabis will have now. No longer being, it'll still be illegal, but it'll be legal for prescription. As a lawyer, I'm going to ask you this question because I've yet to have anybody answer this and anybody actually ponder it with thought. So I'm coming to you for this legal answer to this question. The federal government gave itself a patent for CBD and all other minor cannabinoids back in 2002. It was patent number 6603507. That patent has been extended on multiple occasions. So now, if in fact the federal government takes cannabis off of the Schedule 1, puts it into Schedule 3, could they not go into every dispensary across this country and say, if you have any CBD or any minor cannabinoids in your products, take it off the shelf because you're infringing upon our patent and therefore infringing upon our ability to sell this?
Or I'm sorry.
No, go ahead. Or is this something completely different?
That's a great question. I First of all, the government can do whatever they want. I think we all know that, but I don't think they're going to do that. I really don't think that they're going to do that. I think that this is a whole entire movement that many people have been fighting for, because the making it a Schedule 3 is huge. It's huge on many levels, because now we're putting it on the same playing grounds as Tylenol with codeine.
Right.
So that,
Testosterone is for a couple other drugs, yes.
yeah, so that there are other drugs that are also Schedule 3, but I'm just trying to give your listeners, because when we're throwing around Schedule 1, Schedule 3, it's kind of hard to kind of wrap your mind around exactly what that
Cocaine
means.
is a Schedule 3 drug, is it not? Cocaine
No,
is not a Schedule 1 drug.
no, I know cocaine. I do not know the exact scheduling of cocaine, but it's not Schedule 3. We do have testosterone is on, and some steroids are Schedule 3 as well.
But cocaine can still be prescribed right now. Did you know that?
Yeah.
Yes, a
Well,
doctor can prescribe cocaine in a hospital setting. Boom, write a prescription. And most hospitals have medicinal or medical cocaine in their pharmacies, in hospitals, inside hospitals.
right.
Right.
You're correct. You're correct. But also, if you think about it, if heroin's a schedule
Yeah.
one, I mean, there's different. We've got oxy is an offshoot of heroin. So, I mean, there are ways to pharmaceutically alter to make it fit in it. And that brings into another question, because one of the concerns, and the federal government has kind of tossed this around in some of the meetings, is that if they do this, it's going to make the pharmaceutical companies be able to go in and produce this. Are they going to take it over everything? I mean, what's going to happen to these mom and pop businesses without regulations that are currently part of that cannabis business?
But it's the same thing that's going on right now. You've got the pharmaceutical industry already delving in. You have
Mhm.
Epidiolex. You have a couple of other cannabis-based drugs that are now available
Right.
for sale and prescription in the world. You even now still have Marinol. It's still a prescribable drug
Mhm.
that is a synthetic version of cannabinoids that has been a synthetic drug. So I think, I agree. What's going to happen if this now puts it under farmers' purview, because it does,
Mhm.
it puts it under
Mhm.
a doctor's ability to prescribe. So therefore, I will tell you that I think this will probably be one of the least, just the same way Marinol is one of the least sold drugs in America, one of the most expensive but least sold drugs, because people don't buy it. They don't work. We know Marinol doesn't work. Marinol has
Mhm.
never worked. They tried to do a synthetic version of Delta 9 that has not had any of the effects of street level cannabis, let alone, regular THC coming out of the plant. So from my perspective,
That's
I would
That's
think
a very good point. I mean, that's a very good point. But Congress has also brought up like the Delta 9, because the big problem with Delta 9, which you kind of touched upon there about its ineffectiveness, is the fact that it's synthetic and it's got a lot of extra chemicals in it. And now you're kind of taking away the value that pure cannabis actually has, and all the medicinal effects are no longer there. We're
well,
just
I
going
mean,
with Delta. Yeah.
from my perspective, I mean, why would I buy a product from somebody who said that it didn't work for 20 years and all of a sudden, because they can make money, says it works? Right there. There's no legitimacy behind the pharmaceutical industry whatsoever when it comes to cannabis. There will never be, I would think. So any person who would gravitate towards cannabis wouldn't gravitate towards something created by people who said that they didn't believe in it for 20 years.
I agree with you. I mean, there's a huge distrust. I mean, in general, overall, to start with pharmaceutical companies. But I do think that they have a lot of power. In Congress, huge amounts of money, as we know, for lobbying. And I think even though they are throwing around, as part of the discussion about reclassifying this, they're throwing around potency levels of and all of that, and issues with different things related to that. There is discussion about how are they going to make it so the pharmaceutical company doesn't try and go in and take this over. But it's a very good point that you're making. Is it going to alter anything? Because that just means people are going to get it from elsewhere, like they have been before.
It's just like right now. I mean, since what, 2021, We sold $25 billion worth of legal cannabis in America, $75 billion worth of gray and black market cannabis. This will just go back to the gray and black market again. And you'll still see the same thing unless we completely deschedule. How do you think this is going to, first off, it's going to affect banking. It's going to affect, it will change this whole thing from recommendation to prescription, which is really strange to me because how are they going to do that? I mean, how do you think that will affect that? Well, the DEA has no control over that. So, I mean, how will you still have to have a recommendation to be in a medical state? And every medical state is different. I mean, I'm involved in Georgia. Georgia has a law that doesn't allow for any edibles, any smokables, any vaporables. However, they do have pills and tinctures. So, is it not a pill and edible? Blows my mind.
Right.
So where will they? I mean, if the Fed takes it off of Schedule One, does that then say that in a state like Georgia they're going to have to allow for smokable? Really, how are they going to navigate all these 38 different state legislative rulings?
Mm-hmm. Well, here's the bottom line. I mean, it's going to be regulated if that's the case in the scenario you gave, like healthcare. In Florida, we have medical marijuana. So how it works is you would basically go to a doctor. It can be done here, telemedicine. And then, you have to fill out forms that the state has indicated where you say what your justification to get the cannabis. And then a doctor basically signs off on it and you get a card. So that's how it's pretty much the long and the short of it in Florida. Now, I would assume if, let's say, they put it as a Schedule 3, it would maybe be a similar thing. But you brought up a very good point because we've got states that are entirely recreational where you're just walking in and getting it. Now, could that hypothetically be structured and put where you just have a doctor that's coming in and saying, "Oh, hi, what's your ailment?" Um, uh, you know, just like if you were going to get Tylenol with codeine and somebody says, "Oh, I have cough," and they give it, or "I have a migraine or a headache," or whatever. I mean, that is possible depending on what is put into that piece of legislation.
Yeah, because I'm trying to figure out how will they navigate the 18 states that have rec, what they call rec or adult use. I mean, it doesn't matter whether it's Schedule 1 or Schedule 3 anyway. They have adult use. So, you don't require me to go into a doctor right now for adult use in that state. So how can you require me to go to adult use if they take it off the Schedule 1 and make it Schedule 3? This is just, I think this is going to open up Pandora's boxes that we don't even know. I just had a conversation with somebody recently in Louisiana. Louisiana has medical cannabis, but they also they're crazy because they allow for Delta 8 and Delta 10 in that state, and or THC O, and they are recently trying to pass a regulation that requires them to take all the THC Delta 9 out of their plant, out of their product. I don't get it. Where's this going to fit in this whole big scheme of things? And I mean, will we go through 10 more years of just confusion? I think that's what's about to happen.
Well, obviously the states that you're referring to can do one of two things. They can roll it back, like just when the drinking age changed. What was that in the early
Right,
80s?
right.
They
70s.
right. They could. It was when it was in the
70s.
early 80s.
No, I remember drinking age dropped to 18. And I think that was 71, 72. I should look that up. And then went back up. Went back up. And the only reason why I know this is because I'm a little older than you, my dear.
Only by a smidge.
Yeah, and do you know what's really crazy? When I went to high school, I could go to a restaurant and order in my senior year a glass of wine at the table. Which
Which I think is the correct thing. If you're going to send people off to war and they can fight for our country and enter into contracts and be put to death under the death penalty and all those things, and then you're going to say, oh, they're capable and they're to all of that, which is huge. but they're not capable to go and buy a beer. To me, is
Yeah,
just
it
it's
was
as
insane.
ridiculous as making this illegal.
And that was the argument that was taking place because we were just coming out of Vietnam, a war that nobody was very happy with. I believe. Let me see. When did alcohol drinking age change? I'm gonna look this up while we're talking. Go ahead. But
Okay.
yeah, but it was so crazy that yeah, when I would, and of course I'm going to high school and I'm a high school junior. And I wasn't 18 at the time, but people weren't carding people back then. It was crazy. I went through high school, my junior, senior high school, being able to go into a liquor store and picking up, a 8-pack of the little pony bottles of Michelob beer. Nobody cared back then. And then
Right.
they changed it back, I think, post Vietnam. Let's see. Yes, sir.
Well, I mean, that changed to 21 because of MAD. I mean, similar to the whole situation with the war on drugs. I mean, it was kind of that whole wave of that was going on at the time with our country. I think they upped the drinking age to 21. Then we had Nancy Reagan with all of this, and I mean, it's just ridiculous and mind blowing that it's taken so long. And I've listened to many of your other podcasts where you're saying about there's so much research.
It,
Just
Yeah,
go ahead. I'm sorry.
it's just crazy. I don't want to interrupt our interview, but in 1969, it changed
Mhm.
for 2 years. It went down, and then in 71, it went back up. No, like that can't
Wow.
be 75. It went back up. That's really crazy. I'm
I
learning.
thought it was much later. That is crazy. So
That
that
was,
was right near Vietnam
that was
Vietnam
right
War.
at the end. Matter of fact,
Yeah.
I entered the service in '74, so I got to wear the national defense for Vietnam era. I'm considered a Vietnam era vet. I think we cut that off in '75. So it's crazy that that's when the drinking age went back up to 21 nationally, and I think in some states even kept it under 21 until I think Arkansas. See, pre Arkansas, I think you could have it all the way up until 81. I got to look this up and do the real study. But anyway,
So
so
you were actually active military and you were able to drink and you pretty much come home and they tell you no,
absolutely,
which is
which is
crazy.
crazy. And even after that, you could drink on a base at 18.
Oh,
We
okay.
had they had 3.2 near beer that you could drink on a base for a little while, and then I think they ended up shifting that back over to 21, which was kind of crazy. But coming back to this, I mean, I just do you think this is going to be a quagmire? First off, it's going to take the DEA probably no less than 90 days before they can actually change this because they have to open up.
No less.
Yeah, they're going to have to open it up for public comment,
Right.
all that kind of crap,
Mhm.
and then they're going to push it off because they said they found out something. Then it'll be another 6 months. So let's say they do it at the beginning of next year. I as a lot of people in the industry right now are going, yay! But I don't think they understand why they're going yay because I think this is going to be a little bit more of a nightmare than we think it's going to be.
Well, the point that you just brought up about the states that are recreational, they can do one of two things. They can just roll it back a little, or I mean, they're already saying this is what we're going to do, even though technically it's in violation of federal law. They could keep that stance as well. So it'll be interesting to see what they ended up doing, but. I mean, there are legal workarounds about to be able to enable them to do it. I'm not so sure. I do agree with it hasn't been decided yet, and we have to have, the public outcry. We have to give them is what I call it, give the people that have a problem with it their voice. But once they do it, I don't necessarily think it is going to create as much of a mess long term. Initially, obviously, anytime you have change, it creates that. But we also have the other accompanying laws, the one about banking. And then we also have the HOPE Act. So it does really seem like the federal government is trying to, I want to say, make up for their wrongs having to do with cannabis.
It will. Now let's talk a little bit about how is it going to impact people trying to come into the business, people who want to start businesses, or people want to move. These like I have a fledgling business going myself, which is a brand that I have right now in 2 states. Hopefully soon will be in 3 states. Um, it doesn't affect me as much as it affects others because my brand basically is I basically am licensing formulations for people to be able to put in packaging to sell. I'm using somebody else's license. I'm not the person that has to get the license. So I won't be as affected as those who are actual people opening brick and mortar dispensaries, right?
Well, I think the licensing is the process is pretty much going to stay the same with tweaks, meaning you're still going to need to get a license to do it. I don't foresee necessarily that is going to change. Maybe the process, maybe what they're asking for, depending on the state, will change a little. But I do think that it's going to free up a lot of things because we have to remember, first of all, the way it stands now, cannabis businesses cannot write off business expenses
Any
on their right. They can't write them off. That's huge. So that's like a gain in money. So that's huge. Being able to use traditional banks, that's huge. I mean, I'm just talking from a logistical
being able to use
doing
a credit card when you walk into a dispensary, swipe a credit card, right?
right. The fact that you don't always have to have over your head that, okay, at any moment, the federal government can change their stance and that concern as well. So I think from that end to legitimize it, and make it legal on the federal level is huge. It's really going to change and the way that they're able to do business. I mean, back in the day, I mean, I think you've talked about this. You couldn't get an attorney, to even give you advice. You couldn't get a CPA, all these people, they couldn't even find professional assistance. They were kind of stumbling along trying to figure out how to navigate it on their own without the advice of professionals.
And let me answer it this way because I mean, will this affect the way each individual state gets to charge for a license? I know Florida there for a minute. Didn't Governor DeSantis uh, float this idea of jacking up the price of licenses to $1.5 million or something stupid like that?
Yeah. I mean, now the application is a little over 60, then you have to have a bond. So, but I got to say, DeSantis, I mean, there's so much stuff that comes out of his mouth. I mean, if we're going to get into DeSantis, that's going to take the whole entire podcast and things that he's done and said. So I don't want to go there. But how is it going to affect the license? First of all, I mean, the states within reason can do whatever they want. If it's recreation, it's going to have to change. If they're going to follow whatever the federal guidelines, if they just put their foot down and say, we're going to basically keep it recreational, then it's different. I don't necessarily, and I haven't seen in Florida, obviously it's on our ballot now to make it recreational in November, and there's a high probability it's going to be made recreational. But seeing how the medical marijuana in this state at least has worked, it hasn't necessarily been a hindrance to adults being able to get it, only in the sense that you have to obviously pay to see the doctor on top of the fee that you have to file with the state. So in that sense, I guess you could say and it's not a huge amount, but it is a financial burden for someone who is looking for, the treatment. Also remember though, if the federal government does this, we could have insurance is going to have to cover this. So a lot of people would be able to potentially, just as if you went in with a sore throat and got Tylenol with codeine, would be able to get it paid by the insurance. Now that is going to be a big mess. I mean, the insurance company.
The insurance company, I will bet that they are going to battle this thing until they're last
Yeah,
breath, right?
yeah, yeah. That's going to be a huge kicking stream. Well, you know what? Until they may or may not, because let's say that what are these pharmaceutical drugs are expensive for, whatever you're treating. If you're treating the side effects of cancer, for instance, those pharmaceutical drugs potentially could be very expensive. Whereas if they're prescribing cannabis, they could be as substantially less expensive, especially if there's a lot of people in the industry to make that price come down.
There's going to be, I'm sure, a lot of people looking for advice from people like yourself? I mean, do you think your industry is going to start opening up their doors a little bit more and say, this might be one of those verticals that we've ignored, but we better get into?
Well, I definitely think you're going to have more attorneys jumping into once it's legal on the federal level. I think that it's gotten once they legalized it, obviously, on the state level, there were more attorneys that were brave enough to get into that industry. However, once it becomes legal, then they're not, because there are some states that have the bar regulations have put stricter restraints, or if it's not legal in the other half of the states that where it's not legal at all, then it's going to be able to open up that they will be able to go in and provide legal advice.
But now just the transition from Schedule 1 to Schedule 3, will states have the opportunity to opt out? I don't think they're going to have an opportunity to opt out, right? This will be a federal law. So those states that have been holdouts to this point, there's 11 of them. How can they opt out? They can't deny a person the medication that's available nationwide, right? Or can they?
No, I mean, obviously I'm only licensed in Florida, so I can't speak to the law in other states. However, no, I mean, from a healthcare standpoint, you have, let's say that they reduce it and you have a doctor that's prescribing that, because now, see, the key to what has been determined in the breaking news yesterday was that the federal government is finally acknowledging, and I know this is a fight that that there is some medical benefit. So by saying there's medical benefit, that opens up doctors to being able to prescribe this as medication. So they're not going to be able to opt out if you have a medical doctor that says, because that would actually be practicing medicine without a license. Now, they can put in regulations in their state statutes about a prescribing doctor and things that what they think that they would have to do as part of practicing medicine.
This may be a stretch, but is it going to fall down the lines of, excuse me when I say it this way, but fall down the lines of abortion? I mean, are they going to be able to say that my state's going to say, no, abortion is illegal? My state's going to say abortions are legal. Is it going to be that kind of a thing? Or is because is that
Right.
too big of a stretch or what?
I mean, I definitely see what you're saying. I'm not saying it's a stretch. However, I think that is a different, even though it's definitely political, I think that's a different thing. Because because first of all, abortions aren't on any medical, this is what somebody does to treat something, because we're not like treating pregnancy. I mean, there are protocols for treating pregnancy, but abortion is not a protocol treatment for pregnancy. So in this case, by putting it on the schedule as a Schedule 3, they are saying this does have a medical benefit to it. And so if a doctor finds that you present with whatever symptoms, and that is a reasonable thing based on their experience and based on the medical research, which we do have. Now we even have the federal scientists saying that it does have medical benefit, then they can prescribe that treatment. Whereas abortion is different because it's not a protocol for pregnancy. And obviously from a societal standpoint, there are benefits to it, but it's not a medically beneficial thing for the pregnancy, if that makes sense.
It does, but but then there's all kinds of loopholes in there. I mean, especially if a woman comes in and got an ectopic pregnancy,
Exactly.
that is a medical procedure for ectopic pregnancies. So
Correct.
that I just and just the same way as we've seen the quagmire there, I think we may end up seeing this quagmire in the cannabis space. Though this does open up the doors for more medical research, does it not? And that research the federal government couldn't stop research on cannabis,
Mhm.
or could they? I'm
Well, I mean,
confused about
they're not
that.
gonna, yeah, they're not gonna, well, they've been researching it. We know that, but the federal government, but yeah, now what you're referring to, I think, is more private research
Yeah, more open
into it.
research. Yeah, because
Mhm.
the Fed has research, but they've only allowed for the research of the stuff that they grew, which they knew was grown poorly. So then they've now changed the regulation. They've just issued some regulatory changes to that about a year ago that allowed research to be conducted. If you applied for it, you could actually go and buy cannabis that was at a local dispensary and research that. That I know there were some administrative things changed last year to allow for that. But now that if it goes from Schedule 1 to Schedule 3, you don't need the Fed to intervene in the research in any way, shape, or form. Or maybe I'm wrong.
Well, I mean, it depends on what you're doing the research for. I mean, if you're doing the research to create some other offshoot of cannabis or something, or to use it for something that maybe they don't already have research to suggest it's used for, but there's off-label use of drugs all the time. But I think that what you're saying is that we can have private research into things that maybe haven't been researched to know to have the effect, positive effect from cannabis. And I do think that that's going to open that up, because the key to that is that they have determined that it does have medical benefits. Because what you have to understand is before that, and I think you're well aware of this, before that, they were taking the stance that cannabis had no medical, which is just absurd, no medical benefit to it, and that was the position up until um, you know, basically yesterday when this came out, where they were acknowledging, oh, we've had the federal scientists researching this, and they are finding that there is medical benefits openly.
That was based on the two memos that came out of those HH Health and Human Services, and I think the FDA put one out
Correct.
validating medical efficaciousness of cannabis almost a year ago.
Mhm. Well, it takes them a while.
Yeah,
It's like a bad boyfriend. They don't want to acknowledge when they're wrong.
that was a good one. Look, while anticipating this relaxation of the banking constraints, will this now open the door for more savvy investors getting into the space? And those who are considering trying to become an entrepreneur, will they have more opportunities for finance than, let's say, has been previously available?
Well, I mean, the industry in itself had to get money from somewhere. I mean, a lot of the people that were initially starting were obviously had to have investors and be getting money from somewhere. So I mean, this is going to open up that, since they're allowed to use the traditional, quote unquote, traditional banking methods, that they would be able to go get loans, turnover, just like if you were going to start any other business turnover. The real question is the Small Business Administration going to provide them loans? But it is going to enable them to go in if that passes. Now, remember, that doesn't have to do with the reclassification. That has to do with the act related to the banking. But it is going to open that up, and it really is. You know, I don't think anybody is in disagreement that we need regulations. We're not saying, okay, let's let it just be the wild, wild west and there's no regulations. But it is being able to say this is a legitimate legal business, so they can practice the business like any other business, using traditional banks, getting traditional loans if they want them, and that sort of thing.
Getting traditional tax breaks and that sort of thing also, right?
Correct. Correct.
And will this change in any way, shape, or form, let's say, the entrepreneur who wants to safeguard their innovations that they've come up with or their intellectual property? Is this going to change that in some way?
Yeah. Well, yeah, because right now you cannot get a federal like trademark or anything, like, because it's illegal. So, I mean, there's some people have tried or done workarounds and said it was for one thing or not, but actually submitting what you're supposed to be submitting to get your copyrights and your trademarks and your patents and all that for it, once they do this, you would be able to do that on the federal level. So what people have really been doing is on the state level. But if you want a trademark and you're able to do it, you want to get it for, the whole entire United States, and not have to go in to each individual state and get one.
I'm sure people, coming in, and this just recently changed. And again, it hasn't really changed yet. It's just they announced that they're intending to change, which, like we just saw, again, HHC or HSS asked them to do this a year ago. It took them a year to make the ruling. So it may take them another year to make the next ruling. Have you had people come in your office already saying, well, they changed the law, so can I get in it?
No, because I think because this went up on Apple and everybody was reading it, I haven't had that happen. Or maybe they're more sophisticated and they realize it's like you and know it's going to take a little while. So no, I haven't had anybody walking off the street since yesterday saying, oh, the law has changed. There's a lot of buzz about it for sure. I mean, there's a lot of talk about it. But I haven't had that happen yet. Now that you said that, though, Montel, it'll probably happen tomorrow.
Well, if you had the crystal ball, I mean, this is going to open up opportunities for a lot of people who have been in some ways basically kind of shut out of this industry, especially people who have, even though we claim to have these equitable programs in lots of states, those equitable programs have seemed to just be lip service. I mean, do you think that this is going to open up more opportunity, let's say, for female entrepreneurs to get into the space?
Um, I mean, I think it's definitely going to open up more opportunities for minority business owners to start with. But I also have a huge concern about, the big pharmaceutical companies jumping in and kind of bullying everybody out as well. And that is going to really have to be regulated by the states. Like I said, Congress has been, throwing around some discussions about what we're going to do, but I don't really have confidence in that because they just have, the pharmaceutical companies have so much lobbying money.
Yeah,
But
I mean, I could see, honestly, to tell you the truth, I could see in every single one of the adult use states, the pharmaceutical industry stepping in and saying, wait a second, you can have adult use all you want, but you got to let me be able to provide product to my patients in your state medically. So you better put up together a medical program. What's to stop them from suing a state that doesn't have a medical? They only have they only have the adult use and they don't have a medical. If I'm a patient in that state, I should be able to sue to say, no, you need to have a medical because in a medical state, you shouldn't be able to tax me on certain medicines. So there are things from the consumer, from the patient standpoint, that to me is very obvious that this is going to throw a monkey wrench into the entire way the industry has been running.
Oh, I agree with you. It definitely is. But my perspective is the major monkey wrench after we get over the initial chaos from this being done, which is going to happen, is going to come. I think the pushback we're going to get is really from the pharmaceutical companies and the insurance companies, and I think they're going to go more to the state levels, and they're going to, the two of them are really going to try to take control of that situation, because as soon as you make it the schedule 3 and a doctor can prescribe it, and we don't have this now going on in Florida because it's not legal on the federal level, right? So you have to go to the store and pay for it. But as soon as that's done and a doctor can prescribe it, and then technically there's going to be fights with the insurance company about coverage, because obviously they're going to say it's not, but then it's going to be a push me pull me, because we've already established that it has medical benefits. So I don't know what stance that, once that has been legalized on the federal level, that the insurance companies are going to be able to say, no, I'm not paying for it.
Yeah, and
so now we've got,
I don't see how a state that only has adult use can only maintain adult use. They're going to have to put together a medical program. I mean, wouldn't you think? Because I mean, in an adult use state, I don't need I don't need a doctor recommending this. I don't need anybody recommending this. So if I'm a patient, I should be able to say, excuse me, wait a minute. I should be able to get a product that is a medical product, even looking at it from the standpoint of how much THC is in the product. You know what I mean? Lots of states that have adult use, regulate the THC amounts to a certain level, and they're all different. So I can't, name one over the other. But if I'm a patient in a state and I feel as if a higher potency product would work better for me, I should be able to sue that state and say, you need to put together a medical program. And that's where there could be a real serious monkey wrench put in some certain places, right?
I think what the states would do if they do that, and like, I mean, we're kind of speculating here, obviously, because we don't know what ultimately is going to be contained in the federal regulation. So we are guessing. But one approach, if they were going to put their foot down and say, "Oh, we're going to do recreational," is we still have a doctor that can now prescribe cannabis to treat an ailment, which means that we potentially could have their insurance company still pay for coverage of the cannabis. So you could have a dual where you had that situation where you go into your doctor, I'm not feeling well, the doctor prescribes whatever dose of cannabis, you get your cannabis and it's billed to the insurance company, as well as have where you have a situation where someone goes in. It would kind of be similar to like over the counter, to go back to Tylenol. And the only reason I'm not fixated on Tylenol, but the only reason is it's just an easy analogy. You have Tylenol that you just walk into the drugstore and you get the Tylenol. And then you have Tylenol with codeine that requires the prescription. So it may be that the dosage that you're able to get for recreational may be
So
different
therefore,
as
if you
well.
get it a dosage that's different than recreational, would it come through a pharmacy? And now, are they not getting ready to open up again? And I'm hopefully for all of our listeners out there, I'm not trying to make this confusing to you guys. I'm just letting you know that this is what's about to happen. You think you're going, yay, yay, the DA said, stop going yay, because this is going to be confusing for the whole country for the next year. I'll bet you. First off, if they switch it from Schedule 1 to Schedule 3, and now it's a medication that a doctor can prescribe to me, that means that my local CVS has to carry it or should carry it. If it doesn't carry it, nothing should prohibit me from being able to get cannabis across state lines. I may not be able to get the one from one state to another state, but you have to follow my prescription the same way as you follow my prescription right now. If I have prescription for 8 different medications. If I'm traveling and I go to Boston, I should be able to go into CVS in Boston and say, look, I get it from CVS in Florida. So just call these guys and I want to get it from you. They can't say no. Well, they can say, well, no, I'm sorry, we're not going to participate in this. Well, then I can turn around and sue you because it's a legal medication that you should be able to have provided to me. You know what I'm saying? I think that maybe I'm off of my rocker, but medication
Well,
is different. That's
okay.
different.
So, well, I mean, there are plenty of pharmacies that don't carry certain medication. I mean, that's why we have what's called
Got
compound
it.
pharmacies as well. There's a lot of pharmacies that will not carry like Vicodin and those type of, Schedule 1 narcotics just from safety point position, like some of the smaller pharmacies. So I don't know if you could turn around and sue and say CVS, for instance, because they're not carrying cannabis. But I don't perceive that being a problem because I think there's going to be many pharmacies that are based on healthcare that are going to pop up and there's a demand. So there'll be somebody else that you'll be able to get it. The only hindrance would be is if the state came and made a regulation. And in this case, there's possibly you could bring suit and said, oh, no pharmacy under the pharmacy statutes of that state and the guidelines can carry or sell cannabis.
Now,
That's a
see, what's
different
really strange
situation.
is I am part of the cannabis movement in Georgia. Georgia was the first state that legalized medical cannabis that allowed independent pharmacies to carry cannabis. The DEA issued a warning letter to every one of the independent pharmacies that had signed on and said, if you do this, we're coming after you. But now, if the DEA changes it from Schedule 1 to Schedule 3, they got to rescind that thing and say, yes, you pharmacies can carry this because it's a legal drug, right? That's what they should have to do.
No, that will, I don't, I mean, rescind it, yes. But I mean, if you may, it kind of becomes moot because if it becomes legal or it becomes a schedule, 3, then it kind of moots out the fact that the DEA sending the letter saying you're not allowed to carry this as a pharmacy. But that gets into the whole thing that basically making it legal, then all of those restraints that are there, then we're just down to what does that individual, because healthcare in itself, you're saying that it's like just a complicated mess, but the healthcare industry is a mess in itself, in the sense there's so much regulations. You have state regulations, you have federal
Sure.
regulations, the state regulations vary. So I mean, I think in that sense it's going to vary state by state on the dispensing end of it, because they could put in regulation in one state that says, okay, you can only have an MD, make the prescribe cannabis. Other states could say, oh no, we can have an MD, we could have a dentist, we could have, a chiropractor. So we are gonna have that
And then
varying
you're going
from
to also
state to
have in
state.
states like, let's say, New York and other states that have a dispensary model. They cannot now block, or could they block the pharmacy model? Because I mean, if I were a pharmacist, I own an independent pharmacy in New York, and the DEA just told me that I now have a brand new Schedule 3 drug. How are you going to stop me from putting that Schedule 3 drug on my shelves? It's like any other drug in the country. How can a state say no? No, because we only want to distribute it through this way. You know what I'm saying? So I mean, I just think I just keep throwing out these things that, from my perspective, just seem to be litigation points.
Well, that you make a very good point, because depending on what's going to be in that potential legislation on the federal level, if they could potentially make it like you can't walk in without a prescription and get let's to change it up, steroids. So I mean, you can, but I'm talking legal. So the you would go to a prescription or a compound pharmacy, depending on what it was, and get that something under the guidelines of that state. So the question is that in itself, by putting it on there, going to require a pharmacy? That's the real question. Is it now going to require a pharmacy that it cannot be dispensed from just a
From
store? That
And
because
because
of that.
dispensaries and pharmacies are two different entities, it in some ways could put the dispensaries out of business. However, in a state that doesn't have a medical but only has a adult use, they have dispensaries. I'm talking myself into like a crazy, maelstrom here. But this could be the same thing that we're going to be looking at. I mean, this is the level of craziness that we're going to see in this country for the next year, I think.
I agree, but I think that the legislation ultimately will have an outline of, the THC levels and what constitutes that. I mean, I'm hoping. Although there's healthcare regulations that come out that's like the Stark law is just mind blowing. So, you know, we would hope it would have those guidelines contained in there as to what it is and what it isn't. But whether it is labeled as a pharmacy, a dispensary, and what it can do is really that is going to be more so at the state level and based on that, because what is required for you to get, to be a pharmacy in one state is entirely different, even as it stands today, entirely different from maybe another state.
So I would love to have you back, Alexis, because I think over the course of next year, this is the kind of conversation, and I got to apologize to all our viewers because I feel like I've literally confused this more than I tried to make it easier on you. But I want you to understand that what happened in the last couple of days with the DEA making a statement is going to throw this entire industry into a maelstrom for a while until each individual shareholder works out their own little piece. What do you think?
Well, I agree. There's so much up in the air that it does seem like you just said that everybody was rah, rah, rah. And they thought that, okay, it's just a switch and everything's going to be fine. But there are so many components. It's not in a vacuum, that are already in play and going on. And even if states hadn't start to do recreational use, it's still, there's so much in play, and there's going to be some adjustment time for sure.
Absolutely. And again, you kind of made mention of it earlier, but put that crystal ball on. Do you think Florida is going to be the next state to flop over to become adult use?
I do. It's on the ballot in November. So I think there's a chance, a big chance that it is. I think there's a movement in the country, and all of the studies that have been done, I think that it's it's like 7 out of 10 people think that it should be legalized and for recreational use. I think that's about, I may be wrong about
No, no,
that.
no, you nailed it. We are at
Okay.
91% of people polled believe that it should be available medicinally, and 7 out of 10, it's like 71 or 72% of people polled say that it should just be made legal, period.
Yep. And I think the country's speaking, and I think now we have politicians, but I also think that we have, people that are donating a lot of money to these politicians that want to get in the cannabis game. So I think that we've got that, and we also have this bipartisan now on a lot of things. The only thing that's really not bipartisan right now is just taking it completely out from underneath the Controlled Substance Act.
And I agree. I think the two things in the country that are most bipartisan groups will agree on is any support for military members, and then any support for cannabis. I mean, come on, they were smoking weed when they tried to kick down the doors of of our State Department. So I know said the House of Congress. So I think there was a lot of weed being smoked that day. So look, I got to say thank you so much for being a part of the show, and I want you back, please, and so we can keep kind of cracking this thing open, because I think it's going to be, we'll have to wait until the DEA allows for the public outcry to figure out where that's going to start before we start looking at what the next phases are. But I think this is going to put the industry, I think, in a state of flux, which will be a good thing, because from my perspective, the industry needs to be turned on its head for a minute to start recognizing what the real reasons why this industry ever became a business to begin with. Personally, that's what I feel.
I agree. I agree. And thank you so much for having me too.
Yes, ma'am, for sure. You take care of yourself. For you guys out there, stay, keep tuning in, because I'm going to bring you the real truth and make this a little bit easier for you to navigate this space for you and your family. Thank you so much. Stay informed, get as much knowledge as you can. Try to share that knowledge with others, and, keep staying blunt. Thanks for joining me on Let's Be Blunt with Montel. Please make sure you're subscribed and hit the bell to be notified when new episodes post each week. We'd love to hear your feedback also, so please send us your comments.